month, we're not in a good place. In Africa, there was a 16.7% increase in cases in the last 7 days. There was a 16.4% increase in the Eastern Mediterranean region, a 33% increase in cases across Europe, an 8.6% increase in Southeast Asia, a 10% increase in the Western Pacific. There are more than 24 countries that have epidemic curves that are almost vertical right now. This is not the situation we should be in when we have tools at hand. There are 4 major factors that are driving transmission. One is the virus itself. This is a dangerous virus to begin with. Now we have these virus variants that have increased transmissibility. The second factor is mixing. We know that the social mixing, the social mobility of people is increasing around the world. These events around the world drive transmission because you bring people together if the right interventions are not in place. The third factor is reduced use, inappropriate use of public health and social measures. The use of these measures does not mean lockdown. It's a combination of interventions at the individual level to the community level, and it covers everything from wearing of masks, physical distancing, avoiding these crowded indoor spaces, spending more time outdoors than indoors, improving ventilation, keeping your hands clean. The last factor that's challenging us right now is the inequitable and uneven distribution of vaccines. If you have variants of concern that are circulating, if you have increased social mobility and social mixing, if you have the inappropriate use of public health and social measures, and you have a very susceptible population, the virus will thrive. This is not theoretical. We're not talking about a what-if situation right now. It's happening now. We have the upper hand here. Let's use the tools that we have to keep transmission down and really be smart. Play it safe, do what we can at individual level measures, have really strong policies that are agile, that adapt to the local situation, and we all really need to play our part here and do what we can to drive this transmission down. The virus has a hold over us right now, and we need to regain control over this virus.